want to thank you for inviting me to give this lecture or talk today about what to do if you think your transplant teen might be struggling. And sometimes this is a mix of, is it mood symptoms? Is it trauma symptoms? Are you seeing some non-adherence? And we'll talk about how to consider those all together. I have no financial disclosures or conflicts of interest for this presentation. This information is for educational purposes, and it's not a substitute for reaching out and getting support from a healthcare professional if you are concerned for yourself or for your child. Also, we will be talking about things such as trauma and suicide is within this presentation today, and being mindful of that and some of the feelings that that can evoke. So I also want to give the 988 Suicide and Crisis Lifeline information. Is available 24/7. You can text it or call it if you feel like you or someone that you love is in need of support. So common issues for adolescents. It can be a tumultuous time in life. There's a lot going on, and it can also be a really exciting time. And so what we want to think about is all the things that our adolescents are dealing with and all the things that they're trying to balance. And this is a skill set that they are developing. So it could be school, peers, some of them might have started working, family responsibilities, and for our transplanted youth, it's also about healthcare and healthcare maintenance. They are trying to become more independent in a variety of domains. They are balancing their own self-identity with also wanting to fit in with their peers. This is particularly relevant for our patients that have chronic illnesses that might have felt like they weren't able to do as many things with their peers before. And then for this generation, social media is a major impact for how they interact with each other, but also how they might judge themselves or get ideas about how to cope, or also just get a lot of information all at once, and not necessarily have a break from those things, not having a break from the news or updates, or having a break from answering questions or connecting with peers and having some quieter downtime too. It also goes into that self-identity and fitting in as what they want to try to portray on social media too. So some of the things that a lot of parents and caregivers notice for teenagers that might be happening to some degree is can be periods of irritability and moodiness. There might be some impulsivity and some decision-making that might not be the most ideal. There sometimes is a degree of risk-taking. That could be everything from really procrastinating on getting a project done for school to, breaking curfew at home or things like that. And it doesn't necessarily have to be on the most severe level there. We see changes in sleep patterns. They can be sleeping a lot later into the day, not going to bed as early, staying up late. That can, of course, impact them taking their medications on time as well. Peer challenges. It's not uncommon to have some fractures in their friend network and maybe change friend groups as they move through school systems. Particularly in the COVID era, it was also being online and then offline and not being able to see each other, and then being put back into much more social situations again. And that can be really disruptive for the teens as well. Families might notice that their teen is spending a lot more time in their room, and that room might be particularly dark, especially if they're big into gaming or social media. Sometimes they like to have it dark so they can see their screens better. And then self-expression in dress and hairstyle, you might see some changes in that way too. And again, these are some things that we would expect for teens. And I think of it as in terms of waves. So we're kind of keeping an eye on what the waves are looking like. We know that in our teenage years, there's going to be periods where things get a little bit more turbulent. And what we want to try to help our teens do is to ride out those waves. And are they smaller waves, or there might be, for example, a big wave that happens, but can we help them get back on board and have the coping skills to ride things through? If it seems like what is going on in terms of the irritability and the non-adherence and things that are just not seeming like your teen are sticking, that they're just happening over and over again, or it's a real shift in how they were coping before, then we're looking at some really stormy seas as well. And that can indicate that something else is going on. And also, if we know that there are some stressors or some triggers for that, and we particularly think about that in terms of traumatic events, or is it a red flag warning? Like, how do we avoid that situation, help them sidestep some of these things that we know can be trouble points for them, and again, give them some more coping skills. So for our patients and our teenagers that have chronic illness, we know that these standard teenage struggles, as well as the ones that are more severe, can impact their adherence. They can say that they don't want to miss out again because of their health. That might change like how much they're reporting that things are going on with them, or not feeling well, or symptoms, and it could be that they're missing medications or trying to skip it. There are some body image issues that can come up, particularly we think too about scarring, and that might impact how they think about their illness and how to navigate those discussions with their peer group. And we're also asking them in the same time period to take on some more responsibility in their care and be more involved in medical discussions as well, and learn a bit more about their medications and their health history. And sometimes this can be at odds when a teen wants to not appear as different, or to get some of that separation between those things. You'll see a pie chart here at the top of the page. I use that a lot with my patients, where we think about all the things that are important in their life and things and the responsibilities that they have. And sometimes it feels like that wedge for the healthcare gets really big and it squishes out some of the other things they really want to do. And sometimes they're trying to put back in those things, which then can squish down some of their healthcare aspects, and things start to get missed. And so what we're trying to do is find a balance between those things. So they're staying as healthy as possible and they're thriving as much as possible too. For parents and caregivers, the risks in this time period can just feel higher. This is a young child climbing a wall, but I feel like that it's also symbolic for our emerging adults and our adolescents as well. There are a lot of questions that we think about, like, are we putting too many demands on them? Is there too much juggling of things? Are they involved in too much right now? Or am I nudging a little bit too much? Am I following up a little bit too much and not giving them a chance to be independent? Am I too protective? So all these things can be going on in both medical caregivers as well as parents' minds, in terms of how we're thinking about helping our teenagers move into more independence, and learn some strategies for helping with their overall health. So we think, is this just a phase? Are they just going through a rough patch? Is it growing pains, or just trial and error, where they're just naturally exploring things and saying, like, oh, did I get away with that? Or, oh, nope, I can't really do it. Or does it mean that something else is going on? So this is what we know right now about what's going on with our adolescent and young adult population in terms of their psychological needs. So we're going to take a little step back just to get a framework for why we think about some of these other issues that could be happening in addition to their standard teen development. So the Centers for Disease Control have been, they've been doing a lot of surveys over the years and monitoring how adolescents are doing, specifically doing surveys with high school students. And more than half of the high school students report poor mental health within the past 30 days. And about 40% of them also have a history of feeling so sad that they couldn't engage in their usual activities for at least 2 weeks. And that time frame is important, because that's one of the things that we think about when we're looking at some significant disruption, when we're thinking about depression or anxiety diagnoses as well. It's not the only thing, but it's another one of those flags. In the COVID era, 22% of high school students had suicidal ideation. That means they had thoughts about wanting to die. And 10% of the students reported at least one suicide attempt in the past year. So 80 to 90% of the students are not having those thoughts, are not having those attempts, but 10 to 20% of those students are. And that's why it's important that we still put that on the table as something that could be happening with them. Suicide's the second leading cause of death for youth between ages 10 to 24. So it is definitely something to consider when we're thinking about our children's and our adolescents' mental health. So what do we know about depression in our youth that have chronic medical conditions? Well, we know that depressive symptoms can get in the way of health management learning and trying out and skills development, all those things that can cause some barriers for that. We also know that youth with chronic health conditions also can have an elevated risk for suicidal thoughts, self-harm, which might not be suicidal. So we think about cutting, for as an example, and suicide attempts. And if youth have both a chronic medical condition as well as a chronic psychological condition, that can increase their risk further as well. So that's why we really want to screen for this whole health model and to really get a capture for what's going on with them if they seem to be struggling in certain ways, because this all folds in onto each other. So we want to get a better picture of what's happening. So I was involved in some research looking at some of the common diagnoses that we might see over time in patients across a variety of different transplants, and both before and afterwards. And the most common one was adjustment disorders. And so just sort of a quick psychology 101 here. So that would be when you might see some symptoms of anxiety or depression or both, but not quite at the level to get a formal diagnosis of an anxiety disorder or a major depressive episode, but it's more than you would expect in a situation. So it's an indicator that it's struggling with the adjustment to something new, a new diagnosis, hospitalization, for example. We also see anxiety and depressive and mood disorders within this population, and also trauma disorders. And I also want to give a little context to trauma disorders too, because you can also have, similar to the adjustment disorder, you can also have post-traumatic symptoms that are not at the level of meeting a criteria for having PTSD or a formal trauma diagnosis, but it is causing some disruption in coping. And the important thing here too is that some of those symptoms are actually ones that overlap with depression and some of those other teen factors that you might be seeing. So sleep disruptions, or being more withdrawn, or avoiding things, changes in mood. So it's really important to consider the role of trauma in some of the presentations that we might be seeing for our teenagers too. It can be very short. It can be more of a chronic symptom. They can wax and wane over time. It doesn't have to just be around the time of a traumatic event. Sometimes it comes a bit afterwards when individuals have more time to process what has happened. So we monitor that over the long term. And why is monitoring trauma important? Well, we know for our adolescents and young adult patients that this is more likely to occur when they have more severe, more medically invasive procedures, and sometimes when they are older at the time of their diagnosis too. And so that would be for our teenagers that we are particularly looking at how a new diagnosis or new hospitalization might impact them. And we also know that about 30% of our transplant patients endorse symptoms of trauma. And their lived experience with illness is unique. So we think about, sometimes these studies involve a variety of different medical conditions, but what we also want to think about is how the transplant conditions are unique with a donor, with the type of surgery, with maybe a prolonged admission while waiting for transplant, or a prolonged recovery time. There's lots of different factors in that. I would be remiss if I didn't talk about COVID. So it's been a long 4 years, and there's been a variety of different feelings and different experiences within those 4 years. At the very beginning, a lot of times patients were talking like, hey, wearing masks and having to say no to things and not hang out with people. I know about this as a transplant patient because when I am very immunosuppressed, or if I right after my surgery, or if it's cold and flu season, for example, like they're like, "Yep, this is a skill set I have." And there's also some safety concerns that they had in terms of, do they feel safer in some environments than others? And was everybody in their community kind of following along on those guidelines and what that might mean? We've thought about, like, and talked about the pause and the social engagement and the impact that could have on youth as well as adults. And that the virtual component was great, and it also could use to lead to virtual burnout as well. One of the things I think is important as we're moving through this pandemic, and into this next phase of it, is sometimes some of the things that our patients might have to do might remind them of those more intense pandemic times. For example, if they have a rejection episode, or I mentioned like the cold and flu season, and they're going to have more precautions and more isolation as a result, that could trigger some memories about what that was like and be very stressful. Like, I'm not wanting to go through that again. So sometimes, there a big question that comes up is, all right, well, what are some of the warning signs that this is more than just a teen being a bit more irritable, or just trying some things out and trying some limits, and trying to fit everything in that they want to do with everything that they need to do. And so this is a list that is not exhaustive. This is just some of the things that you might notice and might be indications. And sometimes it might be one, but often it might be a few of them happening together. So physical changes in appearance or hygiene, like they suddenly stop caring um, about like their appearance. They might stop bathing, changing clothes as much. Like they really might, it's a real shift from where they were at before. We can see some increase in substance use in adolescents when they're struggling with some of these other symptoms. A sudden drop in grades at school, social withdrawal from peers and family, and previously enjoyed activities. And the caveat with this is we do expect some changes, as I mentioned before, um, with their developmental age, and also like just with the natural kind of ebb and flow of friendships throughout their school years. So if they're still making new friends, and maybe they used to play this sport, but now they're more interested in this one, or they're more interested in arts and theater now than they were before, but they're swapping them out, so they still have interest. That's less of a concern than they are just very withdrawn and not interested in things. Um, Patients expressing that feeling that they're a burden on others, especially with going to appointments or other things that might get disrupted for the family. These are statements that might come up more often. Engaging in more risky and reckless behavior. So we're thinking, speeding, tickets, accidents, more serious truancy, self-harm behaviors such as cutting, talking about feeling helpless about the future, or having nothing to live for. They might be talking more about suicide or have more of a preoccupation around death. Another caveat with this is, because of social media, and also with whatever is going on in their community, they also might be talking about suicide and somebody dying because that is what they are seeing on their screens, and that might be a big conversation, and they might have experienced loss themselves. So we also want to balance this with, is this them talking about it because they're processing it, or does it seem like it's lasting for a long time and they're having a hard time moving through that experience and talking about some other things, or finding some additional coping strategies. Also, if your teen is researching suicide methods, or getting weapons, or collecting things in that way, then that is definitely a major clue that things might be a bit more serious. So again, we're looking at changes in mood and hygiene and withdrawal that last more than just a few days, more than like a bumpy spot, that you're seeing a pattern of this developing. And it could be an accumulation of these signs and symptoms that you're noticing. So how do you ask your teen how they're doing? Sometimes they're not going to want to talk about it. But keeping an open and safe space for these discussions laying that groundwork is key to helping identify some of these struggles early and helping get them the support that they need. So some tips are kind of picking the time and the space. If it's in the middle of busyness, like getting out the door in the morning, or um, an appointment, or a sporting event, that might not be the best time, because it might not give you more time for follow-up questions if they really start to talk. Um, Sometimes parents set up regular just check-ins with their teen when they know that they don't have something scheduled, and they could do everything from taking a walk to watching a show together to cooking together, whatever it might be. But they know, and the teen knows, that they've got that time that they can always check in. It could be a nighttime check-in, it could be a weekly thing. It looks different for each family, but that can be really important. And also giving some privacy so they can talk about these very personal things. um, so sample phrases just to start, like, how have things been going? Are you doing okay? Um, and also just acknowledging what might be going on in your own family, or what's been going on in the community or at school, and providing that as a framework, like, hey, there's been a lot going on lately, and it's been tough, and I just want to check in and see how you're feeling about this. Because that can open the door. It gives that validation that things are tough, and that they don't always have to be strong and say that everything's okay. That say, yeah, this is a rocky period. How are you doing? This can be tough for all of us. When we're talking about self-harm, it's a similar uh, strategy too, because there might have been something in the news or going on at school or in family or community, or a program on television or something on social media, where it can give a start point for those conversations. Like, I've been concerned about this, too, or I want to check in about this because, or what happened with this person. And I want to see how you're feeling, if you have questions about it or what you're thinking about. Giving, again, that permission, like, sometimes people feel overwhelmed. Have you ever felt that way? Um, there are also some more specific phrases about self-harm and suicide, and talking about it directly doesn't put the idea into their minds. What it does is it gives a space for actually openly talking about it. So, having the questions that you feel comfortable in phrasing for yourself, and starting the conversation with your teen, like, have you ever had thoughts about wanting to hurt yourself or wanting to die? You can use phrases like wanting to kill yourself or ending your life. You can pick the terms and the words that feel the most comfortable for you to say, in those moments too. If they're answering yes to any of those questions with the little stars on there, the next questions are more about, like, just seeing what was going on at the time for them, and what they were feeling, and what helped them cope and what did not help, just to give that space to talk about it, not only to fix it right then, but to talk about it. So it's non-judgmental, not labeling, not saying, oh, I shouldn't do that. It's saying, okay, let me hear you and what's going on. And also saying, hey, this is hard to talk about, and I'm really proud of you for doing it. You can say that also to yourself as a caregiver and a parent, because it is really hard to talk about. So where to go next in the conversation? Whether they say that they've had those thoughts before or not, these similar things. It's listening, 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 reassurance and validation. Like, things can get really hard. Trying to avoid the shoulds, like, you should do this or should do that, and thinking of it more in like a partnership. Like, we're going to get through this together, and I'm here to help you no matter what it is. And let's think about what can help right now, or who we can add into our support that could be helpful for you, whether that's going to be therapy or extra community supports or whatever that might be. And it's also establishing the safe space for a continued check-in and conversation. So again, if they're not saying that they're having these self-harm or suicidal thoughts, it still gives the space to say, I'm struggling with some mood things, or I'm really anxious about that, or to talk about some of those trauma symptoms that might be coming up. If there is more severe symptoms with thoughts of self-harm or suicidal ideation, there is the 988 Suicide and Crisis Lifeline. This one recently changed from a longer phone number, so now it's just 988. It's open 24/7, 365 days a year. It's free and confidential. You can call or text. It has interpretation services for many, many languages and dialects. It also has options available for individuals who use ASL or are deaf or hard of hearing. You can get support in this line for a variety of things, thoughts about suicide, struggles emotionally, crisis interventions, substance use, and it's also available for loved ones who are concerned about a friend, a family member who is really struggling. So it's not just for the person themselves that is having these symptoms, but those for individuals who are trying to help them too. You can always go to the local emergency department for an evaluation if you think that your teen is at risk for harm. There also are state and county specific resources. So there's the 988, which is a national number, but sometimes your state or your county might also have some additional crisis lines or mobile crisis teams that you can also look up and have handy so you can use just in case these situations come up. Safety measures, some of the standard ones that we recommend if you feel like your teen cannot keep themselves safe or is having active suicidal ideation, we think about removing and locking up lethal items. That includes weapons and medications, and not just the prescription medications, but also the ones that the over-the-counter ones like Tylenol and Benadryl and things like that. And don't leave the teen alone if they are in immediate danger of harming themselves. And that could be also calling some other people to help with navigating that too, and how to get them to support and to the emergency department for a further evaluation. Now, let's say your teen has said not having suicidal ideation or thoughts of self-harm, but it could use some extra support. They've got some depressive symptoms, trauma symptoms, anxiety symptoms, they're struggling with their adherence. So you can talk with your primary care doctor or pediatrician for resources. Sometimes they have people in the community they directly work with. The transplant team sometimes has an embedded behavioral health specialist or more than one that can be of help. There also can be school-based supports, especially if some of their stressors are more related to school events or bullying or challenging peer dynamics or just academic stressors as well. Insurance companies now often will have a separate behavioral health provider searches where you can look for both their location and the type of services, but also like specific to the symptoms, telehealth versus in person, and who's accepting new patients, because we do know that there could be long wait list. And we're also thinking about this, not just for the teen, but also for the caregiver and for the family as well. Some primary care and hospital clinics are regularly screening for anxiety and depressive symptoms and for suicidal ideation. So these conversations might actually take place in those clinics as well, and can be the start point for further conversations. Again, even if they're not screening positive on those questions, it opens up a conversation about it that you can utilize later. We really want to think about mental health as part of whole health. You know, sometimes we talk about like the mind-body connection, and I was like, well, your mind is still part of your body. And so this is the you connection. What's happening for you, what's going on with in your world, and how can we help you more? Also, some schools are providing the 988 information for students as a preventative strategy. So your teen might come home with some information about this as well. So parental radar and skills, you know your child. You might get some information that you're observing. You also might get it from other ways. You might see some things that they're saying on their social media accounts. Their friends might come to you, their coaches or teachers. You can also reach out to them if you're having some concerns as well. Thinking about keeping those connections up. We know that the more isolated, the worse the symptoms get. So actually being involved in activities can be really, really helpful. Having a coping plan about who they come to and who is in their support network and what helps them feel better. Having that active list for resources and supports within your network and your community. And, you know, it's also for a caregiver, also the same message that we were saying to our adolescents, which is you don't have to do this alone. We speak up when we need some more help. And so for the caregivers to be able to do that too, and to reach out within their network and within the mental health and medical community for additional supports. So in summary, we're monitoring the wave. Are the symptoms that we're seeing short term? Are they lower intensity? Are they within the expectations of teenage development and coping? Or are they seeming bigger, more frequent, and they're not improving? Mental health concerns aren't uncommon for this population. Teens with a history of chronic illness also can experience them and have additional things to balance. So we're really looking at those depression, anxiety, and trauma symptoms as also impacting their overall health. And it can occur at various times. They can have periods where things are going really smooth and things are it's a little bit more choppy. Stress protection and suicide prevention are the key aims to help bolster a youth's resilience, not just in these teen years, but setting them up for thriving later on. And parents and caregivers have many skills and can benefit from additional support. You don't have to do this on your own. Thank you very much again for the opportunity to talk today.